Hi, Amanda. I am so happy to be here chatting with you today. It is a strange world we're living in. And for birth workers, it is particularly bizarre and also an emergent time to be of service to people. And I wanted to firstly take a moment to introduce you to anyone who's listening who's not familiar with you. Amanda is a midwife in the San Francisco Bay Area, specifically over in the Berkeley, Oakland area. And her practice is called East Bay Midwives. You can find them at eastbaymidwives.com. We'll be sure to note that after this as well at the end of the conversation. Amanda, is there anything else that we should know about you? Why don't you tell us a little bit about your history in birth work and maybe even how you and I know each other?
Yes. Well, firstly, thank you so much for having me. I'm so excited to have this conversation. Sarah and I met several years ago when I was working as a birth and postpartum doula and birth educator. And I worked with GLOW and different GLOW families who were expecting babies and worked in their homes teaching private birth education, and also worked with folks planning home and hospital births in a kind of non-clinical capacity, a doula support role. And then during that time, I started midwifery school, graduated, and opened up a joint practice with another local midwife, Jeannie Che. And now we have East Bay Midwives. We have a great office that's in Albany, and we're seeing folks in the clinic and helping them to plan home birth. And given this recent pandemic, we're shifting our care a lot, and now we're offering a lot more virtual care. So the climate's really changing how we deliver the care, but the midwifery remains, that core midwifery value remains.
Mm-hmm. Very interesting. And what does the virtual care look like, especially as compared to the way that you would deliver that care pre-pandemic?
Pre-pandemic, we're mostly seeing people in our office for routine prenatal, typically an hour long. Folks come in, they bring their kids and partners, and we do their vitals, and we listen to their baby, and we talk about whatever's going on for them. We run whatever routine labs or screens is appropriate for their gestation. And because during the pandemic and during shelter in place, we're really trying to minimize how much time we spend with people, and we're really trying to minimize contact to reduce the risk of transmission of the virus, that means doing the majority of the talking portion of the visit on a call like this. So we'll have a Zoom conversation with a client where we talk to them rather than in person. We do all of the talking virtually. And then we've equipped all of our clients with their own blood pressure cuffs and Dopplers and measuring tapes to measure their bellies so that they can be monitoring their vitals and their baby's vitals at home. And for the folks that need lab work, or we call them essential visits, like we really need to get our hands on their bellies. So families that are closer to having their babies, we'll have them come into the office for a less than 10-minute visit, and we're all masked and gloved up, and we make sure we take their temperature and that they're denying any symptoms of COVID-19. We confirm that they haven't been around anyone who's also experiencing symptoms or has a diagnosis, and then we're really minimizing contact, but still getting that as much contact as we need to make sure that we're giving them the care that they require.
It's so interesting. The first thing that comes to mind is truly how low touch care needs to be in some ways, especially compared to what we live in our common society, our dominant birth culture in America and in most first world developed countries, as we call them, even though we have some of the worst birth outcomes, even compared to developing countries, is that we are a high intervention culture. And I'm hearing that even in obstetric practices, they're doing telemedicine, so virtual visits and fewer in-person patient visits throughout pregnancy. And I'm going to be very interested to see what the data shows in birth outcomes at the end of this run, because the socialization and the training of the civilians, of all of those of us who have grown up here, has been to make us really fear birth without a lot of intervention, a lot of testing. And if you're not doing all of that, what does that look like? And so it's really going to, I'm hoping that it kind of swings people to understand that maybe we don't need as much of that. What we need is more like the emotional one-on-one care, which you actually can do virtually quite sufficiently, versus all of the testing that we do routinely here.
You know, it's such an interesting point that you make. You know, what is virtual care going to mean for birth outcomes in this country? And last week, I had a really interesting conversation with a few hospital-based providers. It was kind of this collaborative meeting with what we call community midwives, so midwives that are offering birth center and home birth care, and hospital providers. And the hospital providers were sharing that now that they're doing virtual visits, they're actually able to access more women that are not always able to make it into the clinic for their visits because they can't get childcare. There's not reliable transportation. And when you can't make it into those visits, when you're not getting even the minimum number of visits required, that's when we're going to see an impact on the outcomes, a negative impact. And so it's really interesting that virtual visits is increasing access. And then I like what you're saying, that it's also, it prevents hospital providers from being so pathology driven because it limits the number of tests and screens that you can do. And it really challenges this way we've been approaching birth in this country, which is this kind of two-pronged, that it's hyper-medicalized, and that doesn't work. And then that not the people that need the care aren't getting it. And it's kind of those two things that contribute to bad outcomes. And I could riff on that for a long time. And this pandemic is really changing those two elements. And we don't know what it's going to look like.
We have no idea. And then on top of that, there's this big swing, and I wonder how big really is. Again, once we look at the data at the end of this chapter, there is a swing that is certainly significant to home birth and birth center birth. And I would love to pick your brain on that. So firstly, are you guys being approached by people who would not normally fit the typical sort of home birth bill, and not necessarily in terms of whether or not they risk in or out of home birth care, but just in terms of like the character and the personality traits, the profile? Are you seeing a change in who is approaching you?
You know, I think that we are, because we're getting a lot of later to care inquiries. So folks that are, well into their third trimesters or even approaching their term window, that window when you can safely have your baby. We're getting a lot of inquiries for folks that the driving reason bringing them to home birth is that they really want to avoid an infection. They really want to stay out of the hospital for fear of COVID-19. And so I think that is really diversifying the kind of normal home birth client. In the Bay Area, there's so much diversity here, and there's a diversity in home birth families too. We've got like home birth families that are just really data driven, and they're all about the evidence. And like you were saying, when we look at maternal outcomes in the US, they're not great. And so when you follow the evidence, you see that home birth is actually really safe. So there's certainly that crowd. There's kind of the more hippy-dippy spiritual crowd that, that's their entry point into home birth. There's folks who they were born at home and everyone in their family was born at home. So that's what's normal for them. And I think now the inquiries are people that are interested in the safety of home birth from a preventing infection perspective.
Interesting. So you might end up getting a lot of people who would be on the cusp anyways, or maybe were like home birth curious and now we're like, you know what, this is actually sounding like a better option. Yeah. Perhaps the idea that we were more comfortable culturally in the hospital, because in America, the hospital is where the babies are born. Yeah. Now this is swinging them from feeling really comfortable in the hospital to now being fearful there. And so let's move to a different place that is now going to feel more comfortable. Very interesting. So talk to us about that. Are people going to birth center to avoid infection? And is that really a better option? What's happening with that?
I think that all community midwives, so birth center providers and home birth providers, are suddenly getting tons of inquiries. And the kind of primary difference between a birth center and a home birth is that in a home birth, you're giving birth at your house. And in a birth center, you're going to somebody else's house. I think that because birth center has the word center in it, it sounds a little more institutionalized. And so I think that there is an assumption that there is some higher level of care or more technology at a birth center, when that's not really the case. It truly is just another person's house that you go to. And for some people, that's a good option. So for somebody that's wanting to not give birth in the hospital because they really want to avoid a COVID-19 infection, among other interventions that they're, maybe hoping to avoid. We know in hospitals we're having super increased rates of unnecessary intervention, including C-section and vacuum delivery. So folks wanting to avoid those things if they can, but maybe they live with housemates, or they live in a multi-generational home, or they live in a place that's not safe for multiple reasons, or maybe they live far away from a hospital, and a birth center might be in a major metropolitan area just closer to a hospital. A birth center might be a really good option for anybody that fits that profile, but a birth center is not providing different and more medications, or the midwives that work at birth centers don't have any separate training. It's pretty much all the same. And actually, birth centers have a slightly higher hospital transport rate, and there's a few different reasons for that. But home birth, the midwives are providing the same level of care. They bring all of the same tools and medications and oxygen, and they have the same training. Those are the meaningful differences. And as you hear, it's so much more subjective to what the client needs.
Are doulas allowed in birth centers right now for birth center births?
I can't speak to all birth centers, but they should be allowed as long as they've also been sheltering in place and respecting social distancing, and they will absolutely be wearing a mask and gloves at the birth.
And doulas are allowed at home births, assuming doulas the same things.
Mm-hmm. Yeah, and in the hospital, no doulas. One partner, if your partner is allowed, and usually they're not permitted to stay for very long
after the birth. Got it. Very interesting. What are you experiencing as you're changing your practice for the current times in terms of practicing with PPE, et cetera? Has that been a learning curve for you, a comfort curve? What's that like?
It's just kind of trial by fire, because there's no standard of care around this. This is all so unprecedented, and we're really trying to interpret research that's coming in on a daily and weekly basis. And so we're in constant talks with different midwives and providers about, okay, how are we interpreting what we know about this virus, and how are we translating that to the care that we're delivering? There's nothing set in stone about how exactly to do this. So we're just trying to be as kind of intentional as we can. So it's been an exciting opportunity, and it's certainly been a challenge, because we want to do our best and the information keeps changing. So what we've decided at this point, like I mentioned, was to do now a number of virtual visits. We didn't feel comfortable not providing tools for our clients to also take their vitals at home. I know many hospital providers are not doing that because they don't have the resources. And also they're consolidating visits, which means they're limiting the number of visits that any one client gets. So two things that we didn't want to do as home birth midwives. We didn't feel comfortable limiting the number of visits, so we went to more virtual care. And we didn't feel comfortable not equipping the clients with the tools they needed to care for themselves. So those were kind of two edits that we made. And then, just wearing more PPE. So now we've done a few births during the pandemic, which means I'm wearing goggles with a mask the whole birth, which I'm so not used to. I want my client to see that I'm smiling or reassured. And I will say that, plenty gets communicated just with the eyes and my voice, but there was already lots of gloves and hand washing and sterile technique before, and now there's this kind of added layer of cautiousness that we're holding, which is certainly a challenge, and this is the new normal.
Tell me what you're seeing in terms of the body's response, the brain and then the body's response to the fear around this pandemic. I have observed and feel very strongly that birth is safest when women feel safest. This is not a unique idea. So, when people ever ask me, where do I think that women should give birth? My answer always is the place where they feel safest. And my first midwife for my oldest child, Leopi Sanderson Edmonds, who practices in the Bay Area, she said to me when I first met her, I said, is it so crazy to be, to have been born overseas, to live in this country, to be a home birth midwife, do you feel like you're constantly having to convince people to give birth at home? And she said, absolutely not. People need to convince me that they want to give birth at home, because the last thing I want to do as a midwife is end up in the hospital with a client who has essentially willed themselves there. And what she means by willed themselves there is that, you know, a woman is going to give birth where she feels safest, because that is what the body will drive her to do, the brain and the body. And in America, women are taught to feel safest at birth in the hospital, which makes sense. That's, you know, that's where the movies show us that birth happens. That's where our recent generations have given birth, the majority of those people. And so that's what we hear. And there's a lot of fear about birthing elsewhere. And so that means that we have more adrenaline when we think about birthing at the hospital, or at home birth, or birthing in a birth center. And like you said, you know, people might feel more comfortable in a birth center because it sounds more institutionalized, even though it's actually just somebody else's home. But it's just the idea that it's a center makes it feel more professional. And we want something that sounds really professional, because that's where the birth happens, is in a highly professional environment, right? And the reason why safety matters is because our adrenaline is lower, and adrenaline is the off switch for contractions. It is the on switch for blood pressure to go up. You know, adrenaline is not good for labor. And so we want our adrenaline to be low. We want to feel very safe. And that's when the body can open, because we don't feel like we're under threat. Now we're walking around all day, every day in a situation where we feel under threat. I'm seeing all sorts of mental health outcomes in the women that I speak with. And I'm wondering what you're seeing on birth in terms of the length of labors, the length of third stage, so pushing, and what mental hurdles you're seeing women come up against, because birth is such a mental game, really, when it comes down to it.
Yeah. You know, I love this question. And you mentioned something before that really struck a chord with me, which was kind of making the observation that this moment is actually giving people permission to consider different birthing options. And like you're saying, our socialization is to give birth in the hospital. That's where we believe the safest place to have your baby is. And for some people, that's absolutely true. For high-risk people, for people that are having twins or other multiples, for people that have underlying health risks, or their baby has some genetic components that mean that they need a higher level of care, that's true. That's the safest place for them. But for low-risk families, uncomplicated pregnancies, which is actually about 80% of the population, home birth and out-of-hospital birth is totally safe. And there's some cognitive dissonance that I think we all experience, where many of us have had negative experiences in healthcare settings and with hospital providers, but our socialization is so strong, that kind of doctor knows best and the hospital is the safest place to be, that actually trumps the experiences we have. And for a lot of people, it even trumps what we know about birth outcomes in the US, which is that we have some of the highest infant and maternal morbidity and mortality rates in the world. And we're, one of the richest countries. So there's something that's not adding up. And the socialization is so powerful that it kind of keeps us from really logically interpreting the information. And so, I often say the same things to folks that are pregnant. You're going to birth where you feel the safest. But the question there is, but if you've been socialized to believe that hospital is the safest, is that really authentic for you? And now this pandemic, the silver lining, is giving people an opportunity to rethink that. And so what I've observed in the births that I've attended, during this pandemic, during shelter in place, is that actually people are suddenly really trusting of their bodies, because the fear has really been more about the institution and the place. There's a lot more critical thinking being done around the institutionalized healthcare setting. And now there's a lot more trust in the process and the body and in the baby, which is really refreshing. And I can't tell you how pleasantly surprised I am by that. And all of the births that I've attended have actually been really beautiful and really diverse, long and short, but I would say all really empowering. And I think all of the moms have just been like, this is so cool. I never would have done this without this pandemic. And now I have this opportunity to see that birth is totally normal. And I had a skilled provider with me and I was in my home. And so I think there's certainly increased fear around being out in the world. I have noticed like increased fear around when can I take my baby to the pediatrician? How do I do that safely? How do I introduce grandparents and family members and friends to my baby? A lot of that's being put off, which is hard. I'm seeing more postpartum challenges, even if someone is lucky enough to have grandparents that live in the same city, grandparents over 65, and maybe they haven't been sheltering in place or at higher risk for any reason, really challenges the support that people get postpartum. So I'm seeing more issues there, and a lot more strength and confidence around the actual birth, which is so cool.
Amanda, that is so interesting. And I love that you're seeing that arc of change within individuals who might not necessarily be comfortable with a variety of birth, of places of birth. And I think this is really helpful. I'm hoping this is really helpful for those who are watching to start to feel into what their authentic choice is. Mm-hmm. And I think it's so interesting when you have something that is such a clear fear, like virus, bad, Yeah. Birth, not as bad. You know what I mean? Yeah. Like when normally in a normal environment, you're so focused on your pregnancy and this birth as something that you need to almost conquer. And like the pain, so many women think about the pain of birth as being like the scariest thing that they've ever thought about. Mm-hmm. And it's interesting to now juxtapose that to something that is right in front of your face that's actually scarier than that.
Right.
So, there's, in Hebrew, there's this concept of gavora, which is like something that you press against that gives you power. That's maybe a difficult thing. And I think of like this virus being this tool for people to actually find greater strength in the things that are going right. Mm-hmm. That maybe would have been places of challenge or fear before this. And I am not a silver linings person, but that's an interesting thing that to observe.
It's so funny that you mentioned that because, of course, shelter in place lined up perfectly with Passover. And then we're thinking about the plague and we're thinking about suffering. And there was just like too many perfect metaphors with COVID-19 and, how do we manage this plague and are we resilient? And I'm really finding that people are finding this inner strength that they didn't know that they had. And people are accessing that strength, which is really proving that they kind of can free themselves from this kind of oppressive culture around birth that we have, which is it's totally out of your control. It's the most dangerous thing. It's the most painful experience. Everything's going to go wrong. And now people are really challenged to see it differently. And I think if there's anything that I want people to know about birth and pregnancy, and in particular home birth, is that they can absolutely do it. Everybody has the strength to give birth, and births look all kinds of different ways, and you can absolutely be safe, protect yourself and your baby. If you're getting regular care and remaining low risk, home birth and birth center for some is actually a totally safe option, and for many people, even safer than the hospital.
Thank you, Amanda. I appreciate all of this information and this conversation. And we can find you at eastbaymidwives.com. And the handle on Instagram is at eastbaymidwives. Awesome. I'm Sarah Lyon. You can find me at Glow Birth and Body, spelled out, on Instagram, or glowbirthandbody.com. You can also find The Birth Deck at The Birth Deck on Instagram or at thebirthdeck.com. We're also available on Amazon. So thanks, Amanda. We'll do another one of these in the future on a different related topic.
Thanks, Sarah. This was fun.